Welcome. My name is Peter Strong. I'm a professional psychotherapist and I offer online therapy. If you would like to see a therapist online for help with agoraphobia, for example, then please do go to my website and learn more about this online therapy service. Many people come to me for help with agoraphobia. And of course, being able to see a therapist online is extremely valuable if you're suffering from agoraphobia and you're experiencing the anxiety of leaving home, of traveling to see a therapist in their office. That's the major problem that we have to overcome, of course, with agoraphobia. We have to learn how to address these anxiety reactions that you're having. And if you can't leave home, then that becomes very difficult. So the online therapy option is a very good choice if you're suffering from severe anxiety and agoraphobia. So the approach that I use for helping people overcome agoraphobia is called Mindfulness Therapy, and it is a very effective approach, one that I have developed over the years and refined, and from my experience it's probably the best approach out there for helping you overcome those anxiety reactions so that you can leave home and go into previously difficult situations and difficult spaces that would have caused great anxiety in the past. Our mission here is to learn how to change those habitual anxiety reactions, and mindfulness therapy is extremely good at doing this. It has some similarities to cognitive behavioral therapy, CBT, but it's much more focused on working at the level of the anxiety itself. Mindfulness therapy works more with emotions than thoughts, because we see thoughts as being really the products of the underlying emotions rather than the other way round. So a common theme in mindfulness therapy is that we understand that thoughts do not cause anxiety, but anxiety certainly cause a lot of thoughts that feed that anxiety. So we have to work with the underlying anxiety directly. You can't do that just by trying to change the thoughts. Those are simply the byproducts of that anxiety. So we do this by, first of all, designing a well-constructed schedule of exposure challenges. That is a necessary part of the recovery process. You design a series of challenges. Doesn't matter how small they are, the point is to do them well and to neutralize any anxiety reactions associated with that particular challenge. Then you progress to a more difficult challenge, and you work with that in the same way using the various mindfulness techniques that I will teach you. But until you can do that challenge without any anxiety reactions at all. And then you move to another challenge, and you move up the series of challenges, progressing in difficulty until you can completely overcome all anxiety. So if it's anxiety in driving to a mall, for example, then the goal will be one of being able to drive to the mall with no anxiety at all. That's the direction that we take in mindfulness therapy. So how do we work with the anxiety? Well, we do this by training before we do each challenge. That is, we imagine doing the challenge in order to find any of those habitual anxiety reactions. So rather than just blindly accepting them and being unprepared and just falling victim to those anxiety habits, we bring in the element of consciousness. We focus mindfully on the anxiety reactions. And then we bring in the qualities of mindfulness that bring about healing that anxiety in that specific situation with that specific trigger. The first part of the healing process is learning to develop what we call equanimity, which means simply that you can sit with that trigger and not react with anxiety or any other emotional or cognitive reaction, that you can be present with it and not react. And the same goes for the anxiety itself. Can you be present with the anxiety or other emotion and not react, but just be present with it? That's the first part of the training, is learning to develop equanimity, and that is an essential part of overcoming anxiety. You have to be able to sit with the triggers and the anxiety itself without reacting or identifying with that anxiety. When you do that, you stop feeding the anxiety. That's the whole point of developing equanimity. You stop feeding the habit. It's rather like an addiction. Anxiety is addictive in its nature. So when you stop feeding the habit of anxiety, the anxiety starts to heal. It starts to resolve itself. It starts to diminish in intensity until it disappears altogether and there is no anxiety left. That is called healing, and that's our goal. So we sit with the anxiety and we help it heal. First of all, by not feeding it through reactivity. So we develop equanimity to do that. That's part of mindfulness. The second factor that promotes healing of anxiety is to develop compassion for the anxiety itself. To see the anxiety as an object in the mind that needs you, that needs your comforting, your compassion to heal. So we learn to see it really in the same way that we might see a child in pain. The first step, of course, is to sit with the child and to develop a quality of presence, conscious presence that's not reactive. That's essential to help the child overcome its suffering. It's exactly the same with our emotions. We must learn to sit with them in this way. Then we start to explore how can we help that emotion heal. With the child, it is exploring how can we interact with the child to help comfort it and help it resolve its suffering. It might be as simple as giving the child a hug, or just giving it your love and comfort is often all that it needs, but it must have that connection with you in order to heal. It needs that reassurance, that quality of human interaction, and this is exactly what we must do with our emotions too. So the anxiety, we need to treat it in the same way, with compassion, with love, with care, with attention, and to find out what will help it heal. It may be the same thing. It may be to actually imagine taking that anxiety and giving it a hug. It might be to embrace it in some way that lets the anxiety feel like it's connected to this much bigger part of you, the part that is able to be present, what we call your true self, which is very much analogous to the parent. So developing that internal relationship between the little self, the anxiety, and your true self, the parent, if you like, is what is usually missing, and is what we are rebuilding through this process of meditating on the anxiety itself. We're using our meditation to build that internal connection that is essential for healing. There are other ways that we can interact with the anxiety that I'll teach you during our sessions together, but those are two very important principles. So we focus on the anxiety in our imagination, we bring about its healing so that we can imagine doing that challenge without any particular anxiety. Then is the time to do the challenge. And then we might also meditate after the challenge as well to reinforce that training. See, what we're really doing here is we're training the anxiety to resolve itself, to heal. We're helping it heal. And this sets up a new pathway in the brain whereby that anxiety, if it gets triggered, is now able to heal itself because of the training. So this is what we call mindfulness-based exposure therapy, and it's extremely effective. So if you'd like to learn more about this approach, and you'd like to schedule some Skype therapy sessions with me to work on your agoraphobia or other form of anxiety, then do please contact me and we can get started. Thank you.